freely on the table. We still want to go ahead and encourage extension, so we're still going to place the pillows, we're still going to place the pillow underneath here, but now we can start doing some direct work to this area. All right? So with direct work to the area, we can start thinking about that fascial tightness, that fascial rigidity, that stuff that we didn't want to touch in acute, we can now start handling in late subacute to chronic. And do a nice breath in. Now, as you guys have heard me say before, this is the time for you guys to practice any and all of the techniques that you would like to practice. Just because I don't necessarily have the finesse to practice all of them, doesn't mean that you shouldn't. Anything that you want to use for the board exam, please use. So goals for this, we're going to go ahead and decrease the rigidity in this area because it will be quite rigid. Nice breath in. And you'll notice I'm not trying to spread at all. I am still trying to do sort of the anterior gliding, if you will. Now, what is something I could recruit in our patient to do? Combination of everything, yeah. But stage 1 is going to be that pelvic tilting. You could recruit it in acute. It might be a little uncomfortable though, but you could. All right, so the way we're going to do that is with the pelvic tilt. Angela, I'll get you to go ahead and take a nice breath in and out. And as she lets it out, I'm actually pulling, I'm not pushing. Right? And then Angela, I'm going to get you to go ahead and tip your hips forward for me, please. Good. And back down. Good. And again, tip forward. Good. And down. Good. And then if this was a posterior herniation, an anterior herniation, we'd go the other direction, right? So you can get to do some active components there. Depending on your patient's capabilities, I wouldn't necessarily go right into the elbow press and the, elbow press and then, what was the next stage called? Press up, thank you, yeah. I won't necessarily get them to do the elbow press or press up unless I have some extra draperage, extra long draperage to keep them nice and covered and secure. Good, and even though we want to encourage extension, we can still do decompression, right? So with a decompression, yes, we are going to be decompressing, but we're not trying to roll the hips backwards, right? We're going to decompress without allowing the hips to roll backwards too far. Okay, Angela, I'll get you to take a big breath in. And let your hips fall. Good. And go ahead and tip your hips forward. Tip, 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 tip. Good. And relax. Good. Good. Tip forward, tip forward. Good. And over. And let it go. So when she lets go, I'm not actually trying to sacral float decompress. Just as simple. I'm actually trying to tip inwards, if anything, and go forward up. Okay? So after you're done working some specifically in the low back, once you've got the structures let go a little bit. What you could do is at this point, this is probably where I would try to elevate the shoulders even more. Actually, that's on the hip. So you can also bring it up in elevations, right? You don't have to elevate it all at once right at the beginning. You could also bring it up in sections as well too. Honestly, for Angela, we probably should have done an anterior herniation so we can deal with her hyperlordosis. Well, too late. You have a posterior herniation. Alright, so can you see how this is bringing her back to extension? Right? So that's exactly what we're going to encourage for our posterior herniations. Alright, so after you've elevated, after you've done some active work, after you've got these structures to kind of let go in their tightness a little bit, then we can actually go ahead and move on to the, is there anything you guys want to see for the prone stuff? Because it's really not specific, it's just decompression and trying to encourage extension. Pretty straightforward. Perfect, you guys are pros. Yes.
Would crosshand promote any, was that a good technique to use for this, or?
So for what would you be trying to achieve with that? First of all?
To hopefully decompress, and maybe not cross-hand, but I like to do it with my elbows where you kind of like lean into it.
Yeah, so I did a variation of a type of decompression where I wasn't necessarily utilizing the top half, I was just utilizing the bottom half.
Yeah,
Totally
I was
fine,
noticing
as
that.
long as you're not trying to do the posterior tilt that normally comes with it. Right? You can do a decompression, but you
Yeah.
still want to encourage extension. Exactly.
Approximation.
Yeah, absolutely. Approximation is a good one. You could absolutely do that combined with some of her pelvic tilts. So you could, I like using my elbows for this one. I like to actually draw together. Angeli, I'll get you to go ahead and tip forward. Good. And release. Good. Breath in. And go ahead and tip. And release. Good. Breath in. Good. Now somebody's gonna have to treat Angeli for an anterior herniation now. All right. And as we know, for all our exams and stuff, yeah.
So for the chronic herniation, we would do like a hip like joint move for like the destruction or increase the space. Is that the proper way?
Yes. Yes, you got it. All right. For all your OP situations, you want to go ahead and remove the pillows from the shoulders. Ideally in this one I wouldn't, but if when you do remove the pillows, the biggest thing that you need to keep in mind is how gently you let the shoulder down. I don't know if you guys saw how slowly I let that shoulder down, because somebody who would feel better brought into extension, what happens if we just go, oh. Not great, right? Alright, so we take our all the cushions. Now we're going to get her all secured to be able to turn her over.
I got a question.
Yep.
Because right now, like we change to like an anterior discrimination, we just put a pillow under the tummy, and then like your two hands is kind of like not approximation, it's go like off.
Correct. So everything I just did, if you had an anterior herniation, you would do the exact opposite. Right? Instead of pillow here and here, we're putting pillow here. Instead of trying to go this way, we're trying to go this way. Right? So just remember which way keeps the jelly in the donut. That's all you need to think about. All right? Good clarity. Any other questions? You guys are killing it. And guess what? You're almost done on Friday. Alright, I'm putting the 2 seconds here. I'll let you know when I'm ready for you to turn over. Alright, Angeli was secure. I'll get you to turn over and move them through. Sorry, very tight cocoon. But in the world of burritos, you want your burrito tight.